Hi, are you a Texas employer that cares about their employees? If you just answered yes to that question, I have a video that I want to show that will really revolutionize your view of how you can help your employees. This is a conversation between a doctor and a risk management specialist that will touch upon all the important information that you are wondering about. Now, are you in a situation where you can't quite afford group health insurance yet? Or maybe you can, but your employees don't take advantage of it because they cannot afford the premiums or the high co-pays. Well, there is a revolutionary model available to you that will address all those problems. Your employees will have 24/7 access to the doctor in person or using advanced technology. The doctor will establish a close relationship with your employee, and he will really get to know the patient and their health history. That leads to early treatment of injuries and diseases. It leads to happy employees who are available to work for you. So it's a win-win situation. Now I suggest we listen to the two experts now, and then you can decide for yourself.
So I'm Dr. Roger Mochigimba. I'm here with Tom Quintero, who is Vice President of Risk Management Services with IBTX. Tom and I have worked together for years. He works with employers and I work with patients and employers to provide medical care for them. Open enrollment is coming up, and there are innovative and economical options out there. In the model that we have at Direct Med Clinic, we have the availability for an employer or an individual to purchase a membership to the clinic. And then when they need health care, it's only $10 a visit. Okay, so this presents more options for employers as they're looking for different healthcare solutions. Tom, how do you see this model as a benefit to employers? Because we know that in the past, employers have kind of struggled as individuals as well, because premiums are high and deductibles are high. So even though folks would have insurance, we found that they don't always have access because that's not the same thing.
I think it's a huge benefit in a number of ways. Today's group health insurance market is crazy. And as you mentioned, access is a problem. Some plans that you may be able to afford as an employer because of your contribution and employee considerations, they may have very large deductibles. So in a sense, you're paying the deductible before you get any benefit of the insurance, but yet you're still paying for your monthly premium on that insurance. So we haven't really had a lot of options in the past. Group health insurance was the go-to. Hospital visits, ER visits, but more importantly, the majority of those visits that are experienced by an employee are those rudimentary health issues, the sickness, the illness, the scratch, the cut, the busted ankle. And those are the visits that are driving that experience or that utilization in the insurance program that they're in. So that cost continues to increase. The utilization increases. We haven't really had an option similar to the one we're talking about today. That option really changes the way we utilize medical services now. And it changes it in such a way that it's now an affordable option. And if we direct more care to the clinic as opposed to the ER or the those clinics that are popping up everywhere, the urgent care, that cost, that utilization and cost comes off of the insurance side and is directed on the clinic side. Well, what happens now is that utilization is dropping, which in turn drops, hopefully, our experience and our premium cost over a couple of years. But also, what it's doing, it's getting back to the doctor-patient relationship that we used to have. Now, it's a cattle call. I mean, you
Right.
go in, you got 5 minutes with the doc or the
Right.
PA, and you're out of there.
Right.
There's the loss of that care, that attention, that relationship, the understanding of that patient-doctor relationship was gone. Well, we're coming back to that now with this program.
Right, right. So that model is called direct primary care, and you're exactly right. It tightens the doctor-patient relationship, and gives people back that access. And as you know, if people are not avoiding care because they can get seen early and when they need to and in a reasonable amount of time, then ER visits will go down, hospital admissions will go down, and then that's going to also save on the insurance utilization for those high ticket visits like that.
There's a multitude of plans that are available. Plans that are rich, plans that are not so rich, and then some basic plans for catastrophic. In the selection from an employer standpoint, you want to try to bring the best possible plan for the best price. It's got to be affordable. Most employers now are asking employees to contribute in that cost. Whether the employer pays 50% or 70% of the care, that employee still has to pay a percentage of that premium. In your plans that have the low deductibles, those are richer plans. They're costly. We see them anywhere from $1,200 a month to $2,200 a month overall for family coverage. Now, what happens if we move to a plan that's got a higher deductible and a lower premium? Well, that money that's being saved by the employer can be directed towards the direct care model. But if we shift those employees from going to the urgent cares or the ERs to the clinic for $10 a visit, what happens to the utilization on the insurance program?
It goes down.
It goes down
Right.
dramatically.
Right.
Now, it may not be as popular with insurance carriers that are in the group health care business, but the employer wins, the employee wins. And now we have employees that are getting care,
Right.
that are being looked at and visiting with the doctor.
And you mentioned the cost of the plan, okay? But we're not cutting costs on medical care with
No.
this. We're actually enhancing the care because we're providing a closer doctor-patient relationship, more access. And so when there's more access, then prevention gets taken care of, and diseases get managed better. They get treated early on. You know, there are since we've been doing this, we've been able to help folks that have come to our DPC model that were trying to go without that had no coverage, and they had chronic disease that was going unmanaged, and that's sad to see from a clinical standpoint, because we know that when you have diabetes or high blood pressure that's untreated, then some of your organs are damaged, and that's not reversible. So we've had a lot of folks come to the model, and now they have affordable health care.
Many years ago, when I was in the construction industry working for a manufacturer and a contractor, I had hired an employee, put him to work in a certain area, progressed really well. Some 15 years ago, I got a call not too long ago from that employer, who's still a client and a very good friend of mine. And he said that employee had passed. He actually died on the shop floor. He died of a massive coronary. And he said to me that employee had been ill for some time. Diabetes, high blood pressure, and other issues. But he didn't get it treated. He had put it off and put it off and put it off because he could not afford the group health insurance. And the fact that instead of purchasing the group health insurance, he decided to make the house payment. He decided to make the
Wow.
truck payment.
Mm-hmm.
In this plan, anybody can afford $10 a visit.
And the membership.
And the membership.
Mm-hmm.
The employer can purchase the membership for those employees at a fraction of the cost of what group health insurance
Employers purchase the memberships.
Yes.
Right. So we, with the direct primary care model, we're getting back to that basic concept of how employers who pay for health care are really in control. Okay? So I'm a trained physician. I know how to provide health care. I have a clinic. You have employers. So we can direct contract and we can get the job done in a more economical way and
An
take care
efficient
of
way.
people. Efficient and economical.
We're offering the model because it is a very valid option, especially for those employers that can't afford group health insurance because their revenues can't justify it, or they're fairly new in the business side, but they can afford the membership and they can contribute to that employee's health care needs. And when you think about it, 80–85% of an employee's utilization is at the clinic level. You know, those
Right.
catastrophics are there in the event that we have a major medical issue that can't be addressed at the clinic. But 80–85%, maybe more, of the issues that people need day to day can be provided at the clinic.
So are you saying that an employer can use the direct primary care model with our clinic to take care of the everyday healthcare needs and then to cover themselves with the mandate, and for the more catastrophic needs, then you and your team can provide a solution for that? And so these two models work together?
Absolutely. And they really enhance each other. They're ideal for that employer that's looking to cover something catastrophic, affordable, and provide for the majority of the healthcare needs those employees need.
I would agree, because that's what we talk about in our clinic that we can do. We provide those extra services that might not be found in a family practice office, like we can give IV fluids, we can give breathing treatments, and we do those splinting and laceration repair. We do all of that for the $10 visit, and then we have economical costs for labs that we pass on to our member patients. So we're always looking for the economical approach to care. But we're not cutting corners. We're giving standard of care, quality health care, but we're doing it economically. And you know, we all have insurance on our cars. The insurance business in healthcare has gotten out of hand a little bit because, for example, we all have insurance on our cars, but we don't use that insurance to change the oil or the windshield wipers. You know, so healthcare insurance is not really designed to pay for the everyday use of healthcare that we're talking about can be done in the clinic on an economical basis. And so that's one of the things that is driving up the cost, is we're trying to make sure all of those things are covered. But it can be covered more economically directly between the doctor and the patient and the employer and the clinic.
Absolutely. I think that's the beauty of this plan. It works and it makes sense. Now, I've got a question for you. Your background has been heavy in occupational medicine also.
Yes.
If an employer was a member, and his employees were members in this plan, and they're getting their health care needs addressed and taken care of, can you also address the need the employer may have if he has a work-related injury?
It just goes right along with what we do.
So if an employee injures himself within course and scope of his employment, he has a laceration, he comes in, you clean, butterfly, examine that employee, and he leaves, what does that cost the employer?
That was, it's just included in the membership.
So it's $10.
Right.
So employers have an option now that's a win-win. You have an employee that is already a member and is getting taken care of by your staff or yourself. You have a relationship with that employee. There's an injury involved. You already have a history on that employee. You know him. You address his injury, and it's a $10 copay to the employer, as opposed to submitting that to his comp carrier, going through the process of the audits and the billing. And now we have a simple system that addresses that employee and his needs, and addresses the employer and his needs. Is that right?
That's right. We're not charging the employee for his work injury. There's rules against that, but we are still taking care of the injured worker directly with the employer. You could tell me also what you think the value of that would be for the employer, because it seems to me that that would decrease their utilization with their comp carrier.
Exactly right. So the win-win situation. Employee's getting taken care of on his health issues. He's a healthier employee. He's working. His family is getting taken care of. Now that employee has a responsibility at work, and he's injured. It's a work-related injury. He comes in, he gets addressed, he gets back to work. Your experience over many, many years in this work-related injury care business, I'm very familiar with. We worked together for many years on that side. You understand what's required by the Texas Workers' Comp Commission. You understand what the employer is looking for in his needs.
Mm-hmm.
You understand that you have a responsibility for that employee's care, number one.
Right.
And you also understand that all those things have to meet for the same goal.
Right.
That's a win-win.
Right.
If we have that situation and that employer now has the ability to treat his work-related injuries at the clinic at $10 a pop, what does that do to the utilization on the workers' comp?
Right.
Our premiums
Mm-hmm.
are going to see the benefit of that.
Mm-hmm.
Why? Premiums are calculated on modifiers for the most part, frequency, severity. If we reduce that dollar amount that is going into the comp pocket, we reduce our experience, we reduce our severity, we reduce the number, and now the calculations for the future cost of their comp insurance or comp premiums also is reduced. But more importantly, we're developing that relationship with the employee that knows he can get treated and he can get back to work and doesn't have to worry about anything when it comes to dollars or modified duty or return to work at full duty.
Right. So I love innovation, and I love trying to help employers with their problems, and injuries are a problem if they get out of hand. So like I said earlier, we know how to treat people, and I'm familiar with what employers need and how they need to avoid recordable injuries. I'm sensitive to that. I can help them take care of the patients without sacrificing good patient care. So we've got other solutions that are available to take that to the next level as well. We just launched a virtual workers' comp clinic wherein we help patients and employers with initial injuries. We sort out whether they're recordable or not, and we provide care virtually when it makes sense. I've got a lot of background in virtual care. I helped start a company called Teladoc in 2004. I was the president of the Physician Association back then, so I'm very familiar with what we can do and what we can't, what is safe and what needs to be moved on. And then with the bill that the governor passed last year, which stated that a video consult establishes a doctor-patient relationship, that opens the door to make the connection with occupational medicine and virtual care and telemedicine. And I call it virtual care because it's actually the next level of telemedicine. Telemedicine, as we usually think about it in the insurance world or with brokers and whatnot, is usually a one-time visit. And then that patient doesn't see that doctor anymore or hear from them. If they need something more than that, then they have to do another consult with maybe another doctor or go into a clinic somewhere. But we are still connected with that patient. So it's not a one-time thing. We establish that doctor-patient relationship, and we can order tests that way and get the results back and interpret them. We can keep our hands on the case until it's resolved, ideally. Okay.
Excellent. You know, as employers, and I used to be an employer before I came to IBTX, as employers, we need to be open and always vigilant of things that are out there that can help us become more efficient, cost effective, and provide that ultimate care and service, not only to our end user, but to our employees. But the potential, not only for employee care, but for employer options and viable options, so that they can continue to operate their business and have employees available to work for them on a day-to-day. Those things are what we're all looking for. But it also helps a smaller employer too, in a big way. So that's why I think it's a win-win.
Great. Well, it's been great to visit with you, Tom. Great to spend time with you as always. And we hope that we've provided some good information for folks that are looking for other options, economical healthcare options in this season of open enrollment.
Absolutely.